Hello everybody, this is Arifa from Toronto and I have two wonderful researchers with me. और ये प्रोग्राम जो होगा हमारी हेल्थ से मुतालिक होगा. हमने अपनी डायबिटीज़ को कैसे कंट्रोल करना है, हाउ टू कंट्रोल आवर कोलेस्ट्रॉल. एंड आई एम वेरी lucky to have Dr. Anthony from England and Dr. David Jenkins हमारे यहाँ टोरंटो में टोरंटो यूनिवर्सिटी के साथ वापसना है. और मैं when I was reading about Dr. David Jenkins, आप देखिएगा कि इन्होंने मेटाबॉलिक इफ़ेक्ट्स ऑफ विस्कस फाइबर्स, यानी वो फ्रूट्स एंड वेजिटेबल्स जो हम खाते हैं फौरी तौर पर उनका इफ़ेक्ट क्या होता है और इन चीज़ों के ज़रिए हम किस तरह से अपनी डायबिटीज़ और मुख्तलिफ हार्ट कंडीशंस को कंट्रोल करते हैं. इनकी जो स्टडी है, स्टडीज़ ऑन कंबाइनिंग कोलेस्ट्रॉल लोअरिंग फूड कंपोनेंट्स. यकीनन आपको पता ही है कि कोलेस्ट्रॉल भी अगर हाई हो तो बहुत सारी और प्रॉब्लम्स हैं. डायबिटीज़ को कंट्रोल करने का कितना बेनिफिट. हमारा पिछला प्रोग्राम भी इट वाज अ वंडरफुल प्रोग्राम कि कौन सी खुराक हमको खाना चाहिए, कौन सी खुराक हमको ज़्यादा ख्याल करनी चाहिए, किस तरह से हमें अपनी कैलोरीज़ को वॉच करना चाहिए और खाना बहुत ज़्यादा नहीं खाना चाहिए, कम खाना चाहिए. Dr. Anthony, you must be surprised that this is an English show. Why Arifa is doing in Urdu as well? Because of course I love my listeners and I got the feedback. People love you, people want to listen to you, but they, it's a mix of everything. Now, Toronto is different from England. Dr. David Jenkins, last program, he knows what is meant by okra, that is bhindi. He knows about that. He knows about lentils, that is dal. So Toronto, people in Toronto, they are phenomenal people and they want to learn something in their own language as well. Dr. Anthony, I welcome you first of all. Thank you very much for being with me. And Dr. David Jenkins, thank you very kindly to have both of you on the show. Yes, please, you go ahead. We are covering the foods, what we should eat, and people must know what they are eating, how much they are eating, and what else? How many calories do they need?
Thank you very much, and thank you, David, for joining us for this further discussion. Last time we talked about dietary fibre and glycemic index and the implication of that for helping people with diabetes to manage their blood glucose. Some very large pieces of work have been done now that relate to weight loss and dietary change in relation to either improving diabetes or preventing the development of diabetes. Do you want to comment on the very large trials that have been going on in the United States and also in other countries in the world?
Well, I think you will, hopefully it will supplement anything that I'm going to say, and I think that's important. I think there have been large studies that have been carried out, studies especially in Britain. I think Glasgow is the sort of the centre for the weight loss program that has been launched, which I think will be interesting to the listeners. That showed that weight loss that was sustained was beneficial for diabetes, and I think that was very useful to be shown because it follows on from a US study where, in fact, a very big study in the United States funded by the National Institutes of Health with many centres, and that showed that weight loss with moderate dietary advice, the sort of thing that allowed diabetes prevention to be demonstrated. That sort of a diet didn't actually result in any of the outcome that was the predetermined outcome, which was cardiovascular disease. Because one of the things that you're really worried about with people with diabetes is cardiovascular disease. It's twice as common in those with diabetes as it would be with the same person without diabetes. So a definite reason for being concerned. And they wanted to see that if you get a measure of better glycemic control, i.e. less cardiovascular disease, if you had exercise and diet over a period of 10 or so years. And they didn't find a difference. And I think we were all tremendously upset by that. I know Mike Lean's study has currently shown a difference, as you perhaps were alluding to earlier. But that study didn't show a difference. But the very interesting thing was that when you looked at the medication use, there was a highly significant difference in medication use. And you saw increased medication use on the control side of the diet and not on the test. So I think what one sees is that when people weren't doing that well, the physicians in charge increased the medication use until they got back into what was considered to be the optimal state. On the test side of the diet, they didn't have to do that because the diet and exercise did it for them. So I think if one looks at the Look Ahead study, which is often quoted as a failure, it wasn't a failure. What it showed was you can do it by two ways. You can either take drugs, which may have side effects, and get to the same cardiovascular status as if you did it with yourself with diet and exercise, where we know of no side effects that are ill effects, but where there are lots of other benefits, health benefits, that may ultimately relate to long-term longevity, in other words, living longer. So if one says one's 60 and one's now going to have to take a statin, that's nice, but if you could get to 60 and you didn't have to take a statin, you may have many other effects that are beneficial in addition. Statins, I have to say, statins are good drugs, so those people who are taking them, I have to say that they are related to anti-inflammatory effects. They've got a number of other effects that are useful, and it looks like,
Yeah. It's also interesting to remember, of course, that a big weight loss is often associated with a reduction of the inflammatory state. And that has been shown very clearly. So with these trials that have been undertaken, such as the one that was done by Roy Taylor and Mike Lean in Glasgow and Newcastle, it started with a very large weight loss of 10 to 12, even 15% of the body weight. Right. And if you measure the signs of inflammation in the body, they go down quite dramatically as a consequence of that. So I think inflammation is one of the largely ignored areas because you can't see it unless there's something really obvious. And yet we can measure it if we measure the right things. So anyway, coming back then. I was just
going to say that it will become, I think, much more mainstream now that Paul Ritker's study, the Cantos study, came out showing that, in fact, not only if you give an anti-inflammatory drug that has no effect on cholesterol or blood pressure, you get a benefit for heart disease and also for cancer death. So I think that this is going to become more mainstream in the next 10, 15 years.
Yeah. But now just returning to glycemic index, which is used in clinical practice in diabetes, your publication last year showed that from all the evidence, the groups that had the lower glycemic index and lower glycemic load, that's glycemic index times the carbohydrate intake, in other words, they had lower carbohydrate intakes, that their actual risk of developing diabetes was less. And the preview study, which I've referred to, is one where over 2,000 individuals started with a 10% weight loss and then went on to a low GI, low GL diet and maintained about 50% of their weight over 3 years. It seems highly likely that when further analyses are done, there may be some support for the notion that the weight maintenance diet in diabetes prevention could well be a lower GI, lower GL diet. Do you think that's a possibility?
Well, I think it's a possibility. But quite honestly, when you're dealing with, and it's a nice idea, Tony, but I think when you're dealing with weight loss, all bets are off, because I think weight loss is such a major determinant that many other determinants that you would otherwise see in weight stable people will not be seen when you see weight loss. In other words, weight loss trumps almost everything else. If you can lose weight, you're in good shape.
Yeah.
And you do it by eliminating foods that you don't need, and you eliminate some foods that you do need. But the overall balance of weight loss seems to be very positive. In those of us who are overweight, I'm not suggesting that people already skinny should carry on losing weight. That's not what I'm saying. But I am saying that the majority of us, if you actually sort of pluck a little of what's around your tummy on the outside, you find that you can sometimes grab pieces of it and that's not good. In other words, it's what we call skin fold thickness. It's not. It's what you don't want.
No.
Sometimes
Exactly.
people console themselves. These are love handles.
You love handles, they do. That's right. And that's because we love our food. It doesn't mean
These are love handles.
Yeah. Okay. So, you and I are looking forward to the possibility that, well, I am certainly, that the type of maintenance diet after these large weight losses will be a low GI, low GL diet. So there's a big task for us to educate people about just what we spoke about in the last segment, which is which foods to eat if you want to move to a lower GI, lower GL diet.
Low GI, low glycemic index.
Yes. Low
You are a
glycemic
doctor,
index.
so you use these terms. These are difficult for a person like me.
Yeah.
Anyways, please go ahead.
Right. So so we're clear about that. Now let's just, if we may, just comment a little bit more about the portfolio diet, because in the previous segment we spoke about the different types of food that would lower blood cholesterol, and then you put them all together in a publication published, I think it was 2003 was the first one, to put them together as a so-called portfolio diet, which has been taken up by a number of North American and European organizations, and indeed is even now, and I've just checked that the Heart UK website still does refer to the portfolio diet. They've done a slight modification of it, but there is information there, and we'll give the website link to some of those sources at the end of the program. But can we just talk a little bit more about the portfolio diet? Because the reality also, you also published another very interesting paper where you were looking at long-term maintenance with the diet over, 6 months or 12 months in two parts of Canada, in Winnipeg and Vancouver. And you found that in Vancouver, people found it more easy to stick to the diet than they did in Winnipeg, and there was a very specific reason for that. Do you want to just tell us that story? Because that
was an
interesting one. Yes.
Okay.
Yeah.
Thank you. Yes, we ran the study across the country, and so we had in Quebec, in the east, Toronto, sort of more central, Winnipeg, very central, so sort of plains country, and then in Vancouver, which is the west coast. We'd always joked with each other, saying, people on the west coast, so it's cloud cuckoo land, everyone's a bit crazy, and they do all sorts of strange things. They used to take a lot of drugs and drop out and play music, and the 1960s almost sort of took off on the west coast, and in the central part, it's a sort of more of a Bible belt, sort of sensible part of the world where people do sensible things, and are very intense, and so we felt that we wondered when we had the entire data of this cross countries trial, whether there were differences, because it would be interesting just to see whether there were differences. So we looked, and there were. And the biggest difference really was with Winnipeg and Vancouver. In other words, a central continental big town and a west coast town. And there was a big difference. And in fact, in Vancouver, the same advice, the same everything, gave you almost a 20% reduction in serum cholesterol, which is big. And in the same advice in Winnipeg gave you a 10%. And then we thought, this is strange. So we looked at the compliance, or the adherence, I think we're now meant to call it. And the adherence was almost twice on the west as it was in the plains. So we thought, this is strange. And so my daughters said to me, well, you look at Happy Cow and just find out how many vegetarian restaurants and health food stores there are per 100,000 of the population in the Vancouver area and in the Winnipeg area. And it was dramatic. There were about 3 per 100,000 in the Winnipeg and 20 in the Vancouver per 100,000. So major difference in terms of availability of food, and whether it was that availability that drove it, or whether it was people's attitudes that created the availability. Probably both. But they certainly fed on one another, so that in fact you had a community and a sort of like an ethic on the west coast, which was more in tune, if you like, with exploring new foods and health foods and these sorts of things. So that doesn't mean to say that it won't happen in the centre. I think it will, and it is happening, but it's somewhat slower than what's already happened on the west.
Now, what we should say is that it was your daughters, or one of your daughters, who pointed out that point, and they have actually recently produced a quite extensive document that helps people who want to take up the portfolio diet. And I've checked; it is available online, and we'll give the link at the end of the program.
Well, I just think that's my major conflict of interest, is having daughters who are doing that.
No, but I think that's a jolly good thing, that you have people who are following and supporting you and working on it and providing good material to help people, which is what it is. So they have, yes, that's great. So we'll put a link to that at the end, so that if people want to do so, they can. Thank
you, Tony. My family will be grateful to you.
That's okay. But let's just finalise then, because the reason I've mentioned that issue about the difference
Dr. Anthony,
between
I have a question over here. Can I ask?
Yes.
In the beginning of the program, Dr. David, you were talking about the inflammation in the body, and that inflammation result in many other things. For example, a person like myself, and I am trying to control my weight, and my doctor sent me for, it's just a scenario, an example, and sends me for the test, and they find that sugar level is high, cholesterol is high. Would they be able to find that kind of, my general practitioner can find what kind of inflammation is in my body, and can that
they can measure your C-reactive protein, CRP. So if they measure CRP, then they will get some idea of inflammation, and it should be really somewhere around 2 or below is in the sort of regular range.
Okay, so this means if you go to your if you go to your doctor, you should ask specially कि आप CRP must be checked.
Well, I think it's as Tony said, it's useful to be checked. It hasn't yet made the main line of things that we check. It's true, but I think it's a useful one to check, at least to have a check, because if you're in the normal range, you're okay, and that may not be something you have as a target. But if it's somewhat raised, then I think it's worth focusing on. It will not probably change anything you do, because, as Tony said, weight loss is a major driver of reducing your CRP. Taking a statin is actually another important way that you lower C-reactive protein. So if you're going to lower your weight and take a statin for your raised cholesterol level, you'll also be doing it for your raised CRP level if you have that component raised in your circulation.
Thank you very much. Dr. Anthony, this question came in my mind, and these days I understand it might be or might not be linked with our topic, but these days mental health is a big issue. Now, because of the mental health, people keep on munching things, eating few things, could be depression, could be something, and then they gain weight, and then do you find any link between all these things, or how would you elaborate it?
Well, I think the answer to this, and I'm sure David will agree, is that it's actually a very complex issue, is the interrelationship between the physiological factors and the behavioral factors that cause people to gain weight. We all know that there are certain times in people's lives where they have a tendency to gain weight. And I do know, for example, that Mike Lean in Glasgow has been looking at the huge amount of data from North America on weight gain during adolescence and young adulthood. And has shown, and it's been presented at one of the meetings, that you can actually detect people who are heading towards weight gain by just watching them over a few years around the age of 16, 17 or 18. That gives you an early sign that there might well be a behavioral component to the way they eat, which is going to lead them to gain weight later. So the answer is many factors will play a part. It is very complex. Each individual has to be treated by the physician and their dietitian on an individual basis. And making generalizations, of course, is therefore a little bit difficult. But David, do you want to add any comment there?
I think you're quite right, Tony. I think it's a very difficult thing. I mean, that's why it's been so difficult for us to get weight loss. I mean, because different people respond differently. Some will say, well, I think a lower carbohydrate diet does me very well. Other people say, no, quite wrong. It's a high fiber, high volume diet which does me very well. and someone else will come in and say, no, it's intermittent fasting that does the thing for me. Another will say, no, it doesn't matter whether you're intermittent, you've just got to eat less. So, and each of them may have success stories. Each of them, that's the important thing. Each may have success stories.
Yeah.
So I think we have a number of ways in which you can lose weight. My own personal suggestion, and it's a personal one, is that if you eat more plant foods, that's not only good for your health, but it's good for the environment. So even if we've got it a little bit wrong on the health side, in the long run, it'll do the right thing, because no one is going to survive being healthy on a dead planet. So, I mean, I think that we've got to think, and I think the Indian diet has been a very good diet if one wants to go on more plant-based foods. So I think that it's ideal for the planet and for health.
Dr. David, my question over here is, yes, our food हमें अपने खुराक के ऊपर जिसमें सब्जियों और फलों का इस्तेमाल ज़्यादा से ज़्यादा रखना चाहिए. Everybody needs shortcuts. Now these days there are, because I have learnt in my life that little bit of everything, like excess of everything is bad. These days there are many programs, Bernstein here in Toronto, there is Atkins diet, there is intermittent fasting, there are some, so many things. So do you suggest that people can stick to any of these paid programs that is wise or not?
I think if people can stick to a program and lose weight, that's successful and that's good for them. But my own, as I said, my own personal view is that a more plant-based diet is good overall. You can use it either in reduced calorie, you can reduce it in intermittent fasting, you can look at it in different types of scenario. You can even do what we would call an eco-Atkins diet. You can do an Atkins diet, which is basically plant-based. You can do a vegan Atkins diet and do very well on that too. So I do believe that it's the weight loss component, which is very useful. I do believe that if you're on plant foods, you get a number of other benefits, lower cholesterol levels and greater volume to your food, because if you've only got a very small volume, I mean, I can probably say to you, I can show you some chocolates. And if I say, would you like, or delicacies that are sweets in some form, and I can say, do you like these? And you eat them. You don't notice. But if I was to say, look, here are a handful of apples, you take one apple, right? You wouldn't take all the apples, but you take the whole box of chocolates, but only one apple. So, I mean, if you look at the difference there, Barbara Rolls has done studies on what she calls volumetrics. You know, as the greater volume of the food, the more you feel satisfied when you've eaten it. If you have a small volume, I don't know, you may be a good person with a very strong will, but if I have a sweet and I'm offered a box of them, I may have 3 or 4 or 5. And I find it sometimes, certainly after the first one, I find it difficult just to say that's it. You may be good. I mean, you probably got strong willpower, but I don't. On the other hand, as I say, if you have apples or pears or oranges, these sort of things, you'll have your taste for sweet, as it were, will be satisfied, but you won't have the whole. You won't have 3 or 4 pounds of them at once.
Dr. David and Dr. Anthony, like at my level and for my listeners is, our lifestyle is very much changed these days. People are not very much into the exercises. And then with the age as well, our metabolism is affected. Now, with this lifestyle, less exercise, sitting in the office, driving cars, and how to enhance metabolism, because of course, even though if I take small calories, I need to burn those. What do you suggest?
I must say you've given you've given the description of the Western lifestyle, which sounds, if I was to talk to my grandmother, she would say this sounds like a sort of prison. You work in a place with walls round and a bright light that shines on you, and then you're taken to somewhere else where you go to sleep. And you're taken on a thing with wheels on it that consumes petroleum, consumes oil from the tar sands or whatever. This seems to be a strange way of living. And I think we are in a very synthetic way of living. And I agree entirely. And that's why for the last 200 years, people have always tried to get back to nature. There are all sorts of groups that have tried over the last 200 years to go back to nature. And I think that's absolutely right. I think we probably have to. I think our population numbers are too great. That's one of our problems. Our cities have become too big. I think we've relied too much on the fossil fuel industry because of it. And I think we've got ourselves into a very, very difficult situation. My suggestion is little steps at a time. Try and use transportation that relies on fossil fuels a little less. I mean, try and walk from one stop of the subway to another stop. Just use it less, and take a little extra exercise. If you've got a park near you, go for walks in your park. Try and look at the birds. Try and look at the other things that are still struggling in urban environments. And in Toronto, we've got a very nice ravine system. And in fact, we do have quite a lot of wildlife that you can watch and you can listen. So that I do think that we've got to step back from the fast-paced life we're in, which is fast food, fast everything, and try and go backwards. So do make yourself some bindi bhaji and some nice dal. Don't get it out of a can.
Thank you very much. Dr. Anthony, this is a real life. I know you are in the research, and as in the beginning, Dr. David also said that in the research, results are different. There are people when they live the actual life, things are different. But anyways, thank you very kindly. It's so good. And Dr. Anthony, I thank you very much that you brought Dr. David Jenkins with us.
Okay, my pleasure.
Thank you. Anything else what you would like to add towards the end?
David?
I'm very satisfied. Thank you. I've had, it's time to push away from the table.
I think that we will provide some additional information at the end of the program, a couple of panels of links to sources and so on, as we usually do. So thank you very much indeed for giving us this opportunity. Thank you.
Thank you very kindly, and I wish I can make everybody understand. I wish we can get some referrals as well if somebody wants to meet or have some good doctors in Toronto like Dr. David. We can have certain references for that. So, in conclusion, what I would say is whatever doctor said कि अपनी खुराक के बीच में fibers, we must have fibers, दालों का इस्तेमाल, हर तरह के beans का इस्तेमाल, हमें walk करना बहुत ज़रूरी है और कहीं नहीं तो from one subway to another subway, अपने घर के पीछे ही, अपने घर के सामने स्कूल के करीब ज़रूर walk कर लें. CRP level डॉक्टर को ख़ास तौर पे कह के आप अपना चेक करें अपना. One thing I would, so this means now having a general practitioner doctor with me, I should have, or everybody must have a dietitian as well. Is that right?
I think a dietitian is absolutely superb to have. Unfortunately, we don't have them paid by OHIP, so you can't consult them in the same way you can a doctor. But you may be able to get a referral to a dietitian. I think that's good if you can.
But that's my health. If I don't want to
depend
on anybody, and if I spend some money to have my own dietitian, that will be a big deal. We must need to have some good dietitians numbers as well, and that's what I will request Dr. Anthony and Dr. David to provide us with. I thank you very much for being with us, and we need your feedback. Do give us your feedback. Thanks to wonderful doctors. God bless you.
Thank you.
Thank you.
Thank you. Stay safe. Stay safe.
Stay safe. Stay blessed. Allah Hafiz.